Cancer is never a very fun topic to discuss, mainly because most of us have experienced its devastating effects firsthand, either personally or through someone close to us. The fact of the matter is, we are not alone. Over 8 million cancer-related deaths occur each year. Some of these cancers could have been prevented through early screening and proper detection. Prevention truly is the best medicine. When detected early, we know that these common cancers have a high survival rate. Annual exams and HPV screening can catch precancerous lesions of the cervix. Proper breast screening and exams can detect breast cancer at early stage. Proper colon screening can catch precancerous polyps that, if detected early, can be removed. Early detection of melanomas can also provide high survival rates. Detecting oral cancer in the early stages is no different. If detected early, oral cancer cases also have high survival rates. Unfortunately, in the U.S., one person dies from oral cancer every hour of the day. The problem with many oral cancers, especially oropharyngeal or throat cancer, is that they are often diagnosed late stage after the patient presents with signs or symptoms. Despite the enormous resources and the amazing advancements in medicine, there still is no cure for late-stage cancers. The best way to fight cancer is early detection through screening. Screening is especially important with oral cancers. Smoking and excess alcohol consumption are two major risk factors for oral cancer. These risk factors mainly cause cancers in the oral cavity, which can usually be detected visually. Over the past 30 years, oral cavity cancers have decreased by 30%. However, oropharyngeal cancers have increased by 700% over the last 30 years. That is a scary statistic. The major risk factor for cancer in the back of the mouth, base of the tongue, tonsillar, and throat is oral HPV infection. Persistent oral HPV infection increases oral cancer risk by 22-fold, while smoking and alcohol consumption only increases the risk by 2 to 3-fold. Dental professionals can notice the traces left behind by tobacco and alcohol consumption, but can't see or feel HPV infection. That is why they should test for it. Knowing the risk factors truly can reduce the incidence of oral cancer. HPV stands for human papillomavirus. It is the most common sexually transmitted disease. About 75% of sexually active individuals will be exposed to HPV at some point in their lives. The virus is transmitted skin to skin through a microabrasion. There is no cure for the virus, and once you are exposed, you will have it for the rest of your life. The majority of contact with this virus will come through sexual activities. However, HPV can also be transmitted through non-sexual methods, such as digital transmission, fingers to oral, fingers to genitals, and vertical transmission, mother to infant. Let's look at the cycle of HPV for the majority of people. New HPV infection. Don't let that part scare you too much. The good news about HPV infection is that 95% of us will usually clear it. The virus will then go into a latent HPV status. However, just because the virus is now dormant, it does not mean that we will get rid of it altogether. A small fraction of the HPV will remain in the body. This means that once exposed to HPV, you will always carry a small amount, which will be undetectable by laboratory test. It is important to note that these latent HPV infections can be reactivated when our immune system is compromised. For that reason, as an older person tests positive for HPV, it could be a newly acquired infection or a reactivation of a previously latent HPV infection. This is very similar to how chickenpox can later manifest itself as shingles. Some people will skip clearing the virus, the latent stage, and go straight to persistent HPV infection. The majority of HPV infection does not cause any symptoms, is not visible, and will go unnoticed. However, persistent HPV can lead to a low-grade lesion, progress to a high-grade lesion, and ultimately invasive cancer. This process may take up to 20 years. Again, all the more reason to screen early and identify your risk factors. It is important to note that HPV is not systemic. Unlike HIV, HPV is site-specific, meaning you could have HPV in a reproductive area and not orally, and vice versa. One more reason for dental professionals to screen for HPV. Also, HPV is not a woman's disease, although much of our knowledge on HPV comes from cervical cancer studies. You may find it interesting to know that cervical cancer cases have dropped over 74% over the last 30 years due to targeted screening techniques. Treatment options really have not changed over the past 50 years for cervical cancer, but screening methods have. It is now standard of care for women to have a pap smear and be screened for cervical HPV. When these two things became standard of care, cancer rates immediately started going down. The medical field discovered that if they could establish HPV status, determine its persistence, and identify a lesion early, that invasive cancer treatments could be avoided. Now, not attending a routine cervical cancer screening is the biggest risk factor for U.S. women getting cervical cancer. We know that almost 100% of all cervical cancer is associated with HPV. In 2017, the incidence of HPV-associated oral cancer surpassed the incidence of cervical cancer. The dental profession has an obligation to reverse this trend. If no oral HPV screening, numbers will continue to increase. Our product, the oral HPV test, can help reverse this trend and ultimately save lives. There are over 200 strains of HPV, many of which are harmless. Our simple test will detect HPV strains 16 and 18. This is important because these two strains are the two high-risk strains associated with oral cancer. Our assay is quantitative. We can see how much of the virus is present and if the viral count is going up or down. If the viral load increases after a positive test, we can establish HPV persistence. Remember, persistent HPV leads to lesions, and lesions can lead to invasive cancer. If the viral load decreases after a positive test, we can see that the immune system is working on clearing the virus. The test is sensitive. It can detect as little as 10 copies per sample. It is specific and will have no cross-reactivity to other HPV types. Our test is accurate. It will not have false positives. Negative results means the HPV is below the detection limit. We are at an important crossroad. If we start oral HPV screening today, we have the chance to reverse the upward trend of oral cancer. We would love to have you join our effort. If you are a provider, offer the screening. If you are a patient, request the screening. Together we can contribute to the reduction of HPV-associated oral cancers and improve the oral cancer survival. Thank you, and remember, stop assuming and start screening.